Alright, Histo, so we're going to pick back up here. So when we were talking about the respiratory system, we talked about the different regions of the throat. These same things are going to be present when we're talking about the digestive tract as well. I mean, obviously food shouldn't be traveling through the nasal pharynx, but the oral and the laryngopharynx are going to be a part of this. You can see a lot of the structures that we talked about before here. Again, tongue, hard palate, soft palate, teeth, all involved in helping to form that bolus. It's going to move it to the back of the oral cavity. Soft palate should squeeze up to the top there and really help that from any food going up there. Sometimes you'll have something weird like that, it may do that, but generally food shouldn't be entering into the nasal cavity at all. You can see the epiglottis can close over the opening to the trachea and make sure the food is going to travel down that esophagus, which is directly behind the trachea. It's actually borrowing some of that space with those C-shaped rings. Again, what ends up being important in this when we're talking about digestion is swallowing. So swallowing or deglutition is this idea of moving ingested foods, which we've started to break down both mechanically and a little bit chemically down to the stomach. And it's really a three-phase process involving first the voluntary moving around the food and getting it ready to swallow. The beginning of the pharynx and esophagus is actually voluntary, and then we're going to have a much more automatic phase. Voluntary phase, like I said, you have your cerebral cortex, so you're using your motor cortex to move foods around, form them into a bolus with that saliva, making sure you have enough saliva to form a bolus. You move it towards the back there, your tongue is going to generally go towards the top of your hard palate. It's going to squeeze up there, and you can see here it starts moving that bolus down your throat. You can see that the soft palate is starting to rise up to seal that off. And you can see it really in the second part of that. You can see the soft palate is sealed the nasal cavity. You have the food going down your throat. You have the epiglottis moving down to seal close the glottis or the trachea. And the food's going to start moving down the esophagus. Once it starts getting to the throat region, this is a little bit more involuntary. Different receptors around this area are going to realize this, and it starts initiating that swallowing reflex, which is going to use the peristalsis to move this down. Again, different contraction of these muscles as we're moving through here, of which you don't really need to know the names of the muscles on this one. But you can see the tongue moves that all the way to the back there, seals that off, starts moving the food down through the esophagus. Once the food enters that oropharynx, like I said, we have that soft palate and uvula moving up to seal the nasal cavity away. You have the hyoidmos and other stuff coming up here to really shorten the tube in front of this, as well as help to seal the epiglottis. And again, this is one of the things you shouldn't be doing. You shouldn't be breathing and try to swallow at the same time. That is generally going to lead to stuff going down the wrong tube. Once it gets to the esophagus, this is going to be completely involuntary, and again, we're going to have those sequential waves or peristalsis happening that is going to move this bolus towards the stomach. You could swallow while standing on your head. Food is still going to go to your stomach. The sphincters at rest are closed. Once you start having the bolus traveling down here, they can open up, allow stuff to go through there, and then we'll close again afterwards, preventing any reflux. And again, that's a big deal with the esophagus, because the stomach being full of acid can have some issues with reflux if you are getting stomach contents back into your esophagus. And you can see this peristalsis is the movement of this down here. It's going to work its way down to the stomach, to that cardiac region or esophageal region of the stomach. And again, you can see all this kind of together here, showing the first stage is voluntary. The next two after that are a lot more involuntary. The esophagus, when you look at it, is really just a collapsed muscular tube. Begins up at the cartilage and the larynx. It's right in front of the vertebrae and right behind the trachea. Just the last little bit of this is actually in the abdomen. It passes through the esophagus. There is an opening in the esophagus called, not the esophagus, an opening in the diaphragm called the esophageal hiatus. When you really think about it, it is a food tube. I always kind of liken the esophagus to a laundry chute. If you have a laundry chute in your house, the laundry chute doesn't do any laundry. It's just there to get from where you're generating the laundry to where it needs to go to. And this is really what the esophagus is doing. There's a little bit of mucus secretion taking place in the esophagus to make sure stuff is moving down the tube freely. Outside of that, there's no real secretion. There's no digestion initiated by the esophagus taking place. It is really acting as a food chute, where we take it into where it's going to start getting processed some more. At the upper part of the esophagus, the superior esophageal sphincter, right where the esophagus and the pharynx meet, there is a little bit of skeletal muscle there. This is one of the ways you could, if you're doing a histology course, you can actually tell upper, middle, and lower esophagus apart. The lower esophageal sphincter, or inferior one, is sometimes also called the cardiac sphincter. When you look at this, it is non-keratinized stratified squamous. Lots of elastic tissue underneath, so we can, if you're taking a big swallow of something, it can distend quite a bit and then go back. And like I said, lubricating mucus glands, and that's really about it. Like I said, sometimes you can have what's called heartburn. That is actually the acid from the stomach churning and coming back up into the esophagus. The esophagus does not have any protective mechanisms, so this can definitely be a problem. It can lead to scarring if it happens enough, and just a little bit of pain if it's happening just once in a while. Generally, it's a lot about being overweight, but sometimes it's the actual just anatomy of those structures. And again, if it's chronic, that's what they call acid reflux or gastroesophageal reflux disease. Again, over time, that can scar the opening there because there is no protective mucus that we'll see is present in the stomach. A lot of times can lead to issues with cancer. Sometimes they'll treat it with anti-acidic type of drugs, proton pump inhibitors. Every once in a while, will do surgery. I knew somebody that had to have surgery where they went in there and changed the anatomy just a little bit of that structure to help prevent that. So we talk about next time, we'll talk about the stomach.